Imagine discovering that the healthcare provider trusted with your loved one's care is secretly incentivizing cost-cutting measures that could jeopardize their health. This is the startling revelation about UnitedHealth's operations in nursing homes across the U.S. The Guardian's article called "Revealed UnitedHealth Secretly Paid Nursing Homes to Reduce Hospital Transfers" uncovers the hidden bonuses, the manipulation of care protocols, and the dire consequences faced by residents. Stay tuned as we delve into the details of this healthcare scandal that raises questions about patient safety and corporate ethics. Welcome to a new video. This time we will talk about the Guardian's article describing UnitedHealth Group's controversial practices within nursing homes. As the largest healthcare conglomerate in the United States, UnitedHealth holds significant influence in Medicare Advantage plans. However, recent revelations indicate that the company has been secretly paying nursing homes to reduce hospital transfers, potentially at the expense of resident health. In this video, we'll explore how these undisclosed incentives have led to delayed medical treatments, whistleblower allegations, and moral dilemmas for healthcare professionals. We'll examine the implications of these cost-cutting tactics on patient welfare and the broader healthcare industry. Join us as we uncover the truth behind UnitedHealth's nursing home practices and the impact on thousands of vulnerable residents. In this video, we dive in the intricate workings of UnitedHealth's secretive nursing home program. An article posted by The Guardian suggests that UnitedHealth has been offering financial bonuses to nursing homes that reduce hospital transfers for residents. While the company claims these practices aim to prevent unnecessary hospitalizations, whistleblowers and other insiders argue they result in denied or delayed care for those in need. We'll examine the role of UnitedHealth's medical teams stationed in these facilities and how they influence critical healthcare decisions. Through real-life cases, we'll highlight the tragic outcomes faced by residents who didn't receive timely hospital care, including permanent brain damage and other severe health issues. This video will also discuss the broader ethical questions raised by UnitedHealth's focus on cost savings over patient care. How do these practices align with the principles of healthcare? What does this mean for the future of Medicare Advantage plans and the responsibility of insurers? Join us as we navigate these complex issues and consider the messages and concerns of whistleblowers calling for accountability and transparency. The investigation conducted by The Guardian has thrown a spotlight on UnitedHealth Group, the largest healthcare conglomerate in the U.S., revealing controversial practices aimed at reducing hospital transfers from nursing homes. The company has been secretly incentivizing nursing homes with bonuses to lower the number of hospitalizations, thereby saving costs. This scheme, while financially beneficial for UnitedHealth, has raised serious concerns over the health and well-being of nursing home residents who might have been deprived of needed hospital care. Whistleblowers, backed by Whistleblower Aid, have stepped forward, alleging that these tactics have led to residents receiving lower standards of care, with some suffering from long-term health consequences due to delayed hospital transfers. Confidential sources and documents obtained during the investigation indicate that UnitedHealth has deeply embedded itself into nearly 2,000 nursing homes across the United States by offering a variety of financial incentives to reduce medical spending. These included premium dividend and shared savings payments, with the Quality and Shared Risk scheme offering significant bonuses to those cutting costs while penalizing homes that did not meet certain criteria. A critical metric, admits per thousand or APK, was used to determine eligibility for bonuses, indicating how often residents were hospitalized. Those with a high APK received no bonuses. This system has reportedly driven questionable practices, with UnitedHealth medical staff intervening in medical decisions that may have put profit over patient health, evidenced by reports of denied or delayed hospital transfers resulting in permanent damage to some residents. Geared towards reducing costs, UnitedHealth's tactics included more than just financial incentives. Internal communications suggest the deployment of admission budgets for nursing home staff, closely monitoring hospitalization frequencies, and even influencing patients' treatment preferences through code status changes such as "Do Not Resuscitate" DNR orders. The ethical implications are profound, as several current and former nurse practitioners revealed pressure from superiors to persuade residents to alter their care preferences potentially against their wishes. In response to these revelations, UnitedHealth claims that their initiative seeks to enhance care coordination by providing nursing homes with on-site nurse practitioners and improved communication systems, arguing these efforts ultimately benefit residents by preventing unnecessary hospital visits. However, interviews and internal documents reflect a program where costs trump care, actively discouraging hospital transfers even when urgent treatment is warranted. This scheme's impact is now drawing scrutiny from both federal investigations and legal action. Previous lawsuits, such as the one filed by former nurse practitioner Maxwell Olivant, despite ultimately being dismissed, highlight systemic issues surrounding transparency, and the exploitation of Medicare Advantage funds. His claims criticized UnitedHealth's practices for potentially violating the False Claims Act by withholding necessary medical services. During its investigation, the Department of Justice found significant factual inaccuracies in the allegations and declined further action. This intricate web of financial motivation and patient care manipulation raises questions about the ethical responsibilities of health insurers and the effects of aggressive cost-cutting tactics on the most vulnerable individuals in nursing home care. Questionable medical practices allegedly fostered by UnitedHealth's program further complicate the narrative, where misdiagnoses or delayed assessments by UnitedHealth's remote medical teams have reportedly led to severe patient outcomes. Notably, cases have been documented where critical symptoms like those of strokes were potentially misinterpreted as less severe conditions, thereby delaying crucial hospital transfers. The case of a specific resident in Renton, Washington illustrates a scenario where the UnitedHealth remote staff interpreted stroke symptoms as a transient ischemic attack, TIA, postponing essential treatment and possibly exacerbating the patient's condition. The overarching unease is that such initial assessments made by less experienced practitioners or under non-urgent protocols resulted in residents suffering irreversible damage without prompt treatment. Administratively, nursing staff reported being compelled to conform to non-traditional treatment workflows dictated by UnitedHealth, with reports suggesting that direct care decisions transitioned more towards UnitedHealth's discretion rather than resting with nursing home physicians. Training sessions were scheduled for facilities that bypassed these new protocols, reinforcing adherence to the cost-saving measures. These revelations have raised the question of whether the primary beneficiaries of these healthcare initiatives are the residents themselves or UnitedHealth's profit margins. Families of affected patients, like Kevin Keep, often remain in the dark about the specifics of their loved one's care discrepancies until after significant damage has occurred. This investigation thus opens a dialogue about the balance between managing healthcare costs and safeguarding essential medical care for those most in need, necessitating increased oversight and accountability for corporate practices affecting human lives. The Guardian's article suggests a troubling pattern of behavior by UnitedHealth Group within nursing homes nationwide. This healthcare giant, in its quest to cut costs and maximize profits, has been secretly incentivizing nursing homes to minimize hospital transfers for residents. By embedding their medical teams into these facilities, UnitedHealth exerts considerable influence over critical healthcare decisions, often prioritizing financial outcomes over patient care. We've seen how this approach has led to dire consequences for nursing home residents, including cases of permanent brain damage due to delayed hospitalizations. The Guardian sources reveal that UnitedHealth's internal protocols and bonus systems encourage reductions in medical spending at the potential expense of resident health. Whistleblowers have bravely come forward to highlight the ethical concerns surrounding these practices, urging for greater accountability and oversight in the healthcare industry. Through the voices of those affected, from the families of residents to former and current healthcare professionals, we see a picture of a system that, at times, prioritizes profit margins over human lives. As we conclude, it's crucial to reflect on the systemic issues highlighted by this investigation. What responsibilities do large healthcare providers have to their patients, particularly the most vulnerable populations? How can healthcare systems strike a balance between financial sustainability and the provision of high-quality care? The answers to these questions are vital for the future of healthcare and the protection of patient rights. As more information comes to light, it is imperative for regulators, lawmakers, and the public to scrutinize these practices and demand transparency and ethical conduct from those entrusted with our healthcare. If you found this investigation insightful, please subscribe to our channel for more in-depth explorations of crucial healthcare topics. Don't forget to like this video and share it with others concerned about patient care and healthcare ethics. For more content on the business side of healthcare, check out our playlists Wall Street, Companies, and Investment 101. Thank you for watching and stay informed.